And essentially, what we have to do here is to look at some cases and see the available strategy to address such cases. So invariably, we are looking at a few cases and we'll prefer the strategy to solve the problem. In this case, we'll start with a case that is related to child welfare and protection. I want to believe you are also working with the local government or you are working with the state ministry. Hello, can you hear me? Hello, can you hear me?
Yes, I can hear you. I said I'm working with the federal government.
Oh, with the federal government. Which of the ministry?
Women Affairs.
Women Affairs. Federal Ministry of Women Affairs in Abuja, right?
Yes.
Oh, great. Great. Okay. You are a director of Women Affairs?
I'm a director there, yes.
Oh, great. You are welcome. So, since you are the federal, the social work desk is not new to you, and the social welfare activities are not new to you as well. I want to believe that.
Okay.
Given that background, you must have handled a number of cases that are related to women affairs, gender-based violence,
yes,
women empowerment, addressing poverty among the rural poor, trying to elevate poverty among the poor, addressing the needs of the widows, the orphans, and so on and so forth.
Vulnerable people.
All the vulnerable people. That was all the vulnerable people. You must have handled one program or the other, or you must have designed one program or the other, or you must have implemented a number of policies related to these areas I have mentioned. Just a few. So given that background, that will give you a kind of launch path for you to understand better this particular course about taking. And in that case, we are looking at the practical or practicability of some of these things we read in papers, we read in the policy and so on and so forth. You know, Nigeria is fond of policies. If we are taking stock of the policies that Nigeria have formulated, in fact, the list will be so long. But just let us assess and evaluate the implementation of such policies. You know, one will be surprised to see that we have not moved far. We are only making efforts. We are exerting energy, but the work done is zero. We are not making any movement. We are not making any progress. But talk of the idea of putting policy on ground. Nigerians have that good idea. They have that good knowledge. They possess the required skill to put on table good policy, implementable policy. But let us go to implementation. Implementation is another thing. So if I have my way, I will advise Nigeria not to formulate any new policy. Let us just stand on the existing one and ensure that we implement them to the letter. If we do that, Nigeria will be better. Do you share that idea?
In as much as I share your idea, but I have my own opinion about it.
All right.
The policies themselves are not bad. To an extent, we are implementing policies, but we do not track the implementation of these policies in different ways.
Okay.
There's no monitoring. There's no policy instrument to track the implementation of these policies that we make. So it's difficult for you without a tracking measure to assess the implementation of the policies that are being done, that are being implemented, because even in small things that we do, we are implementing those policies. But because there's no tracking, even when there are tools for it to be tracked, it's not being tracked.
Okay.
So it becomes the policy becomes a somersault. It's something that you cannot say we are implementing because there's no tracking, there's no political will to track the implementation of these policies.
Yes. And are you saying that those mechanisms or measures are not put in that policy? What I mean is, are you saying those measures are not in the policy framework? Or we just decide to look away?
Sorry, sir. For each of the policies, there's implementation plan.
Yes.
There's implementation plan, like the Child Rights Act, like the Resolution 1323. We have NAP, but those policies are there. But no, either due to financial constraints or due to corruption. And there are so many factors that lead to it not being implemented. It's not as if it's not being implemented, being tracked, and the implementation, maybe monies that are due to be used for implementation are not fully utilized. So when you want to measure what funds have been used for, you cannot see it on ground.
Imagine. Exactly, that is what I'm saying. So, and the problem, you can see that it has become systemic with Nigeria culture, isn't it? Why do we have to put policy on paper? Why do we have to have documents and we will not monitor and will not track the progress? If there have been any problem, I think the subsequent policies will have addressed that. And I can't see subsequent policies addressing those challenges that must have been identified as an earlier policy. Anyhow, whatever the case may be, I'm putting that across because if today we are not policy formulators, if today we are implementers, tomorrow we may become policy makers and we may have our way influencing. Hello? Hello?
Hello, I'm hearing you.
Hello?
Hello, I'm hearing you.
Okay, I thought you were
hearing you.
So what I'm okay.
No, I didn't
What I'm saying
anything.
is that sorry, if today we are incapacitated to influence areas we have identified in policy implementation, I think tomorrow may afford us the opportunity to bring up a change or to effect a change in what we observe today. That is, if you don't have influence today, tomorrow you will have that influence. How will you use that influence to ensure that we have a better society, we have a better Nigeria? So that is just by the way, because the other class will dwell well on policy implementation and some of these challenges were identified. Just to whet your appetite to know where we actually ended and what we actually talk about with regards to policy formulation and implementation. But everyone, my belief is that change can begin with every one of us. If on your desk you can effect a change, and on my desk I can also effect such change, I know at a time those one will come together to bring a desired change that we need in this country. So going to child welfare and protection, we can look at a case in child welfare and protection. What are those issues that may come up in child welfare and protection? Example, if we have a 9-year-old boy that is neglected in a rural setting or in a rural community, perhaps in Oyo State or in Osun State or even in Abia State, if you have a 9-year-old that is neglected, you know those issues the 9-year-old will experience or may be facing could be child neglect in one respect. It could be malnutrition because it's a 9-year-old that is neglected. Such a person may not even get enough food to eat, and that could lead to malnutrition. Then that can also be lack of education. Such a child may not even have access to education because it's already neglected. It's already neglected in a rural community that is not well connected with quality education. Perhaps a rural community that has no primary school, talk less of secondary school. So those are the issues that such a child may face. And how best can we approach that issue as a social worker? In such, one can conduct home visits and design a child-focused assessment. Child-focused assessment in that the child will be focused and an assessment, overall assessment of that child will have to be taken. That's the best practice. It has to be taken. Conduct home visit to get that child, to know the place, the origin of that child, and you now try to conduct a kind of assessment that is child-focused. After that, you have done that on your own. What could be done again is to collaborate with the Ministry of perhaps Ministry of Social Affairs or Ministry of Women and Children Affairs as any related ministry, relevant ministry that you think can be of help in this regard. One need to collaborate with that. In essence, this is emphasizing partnership, emphasizing collaboration, and because in social work you can't do it alone. You can't work in silo. You work in conjunction with other professionals, and you need to ensure you have a kind of collaboration. Collaboration and partnership, they are very, very essential in what we do in order to have a successful program or activity. In this case, you can also collaborate with the Ministry of Education, perhaps through the universal basic education, through their universal basic education program. Such a child can be linked to that so that such a child will have the opportunity of accessing education which is lacking in his own case. And from age 1 to is it age 1 to 12, age 1 to 10? Those from primary school up to basic education, I think those ones are concerned. Those ones concerned are being taken by the UB, Universal Basic Education Commission. There is this homegrown food program.
Homegrown school feeding program.
And this gives free school feeding program. That's what I'm saying. Homegrown school feeding program that is on. Such a child can be enrolled in such a school where he can also get the benefits of free food while in school. That will encourage the child to also encourage that child to stay in such school. That is one. The other case that we can consider, I will give you room to, when I finish those cases, we'll discuss together again and see areas where we can also look at. Then we can also look at gender-based violence. Perhaps gender-based violence in Lagos. These days it's rampant, most especially in the cities. And even though it happens in the rural setting, but most often than not, those ones that are reported happen among the allies. I don't know if you agree with me. Look at the recent case of that Miriam Sanda that has just been pardoned by Mr. President for killing her husband. I wouldn't know whether you follow the story. Did you hear about it?
You are hearing it.
Did you hear about it?
That what?
Hello?
I'm hearing you.
Did you hear about that lady, Miriam Sanda, that killed her husband
It happened in Abuja now.
Exactly, that's what I'm saying. Because those ones that are reported, that's my belief, are those that affect the airlines. You know, there are many cases of unreported gender-based violence, isn't it? There are many cases of unreported because
no reportage. It's the same thing. Just continue.
You said what?
Hello, sir. I said no reportage of the issue. That's people because of culture, patriarchy,
exactly.
and so on.
Religion
People
and
are
so
afraid
on.
of and so on.
Yes.
So that they will not be ostracized.
Exactly. Exactly, that's what I'm saying. But you agree with me that this happens even in across settings. But those ones that are reported are those that happen to the airlines mostly, especially if you are a public figure. You consider a case of a lady that just survived a domestic violence. So what are the issues that is likely to face? It could face the issue of it could be an issue of intimate partner violence. It could be because of you also face the issue of economic dependence, and it could be child risk and so on and so forth. How best do we address that? We're trying to plan a kind of a crisis intervention and safety. How best do you provide security for such a lady, and how does he live her life after that experience? You could refer such a lady to gender-based violence centers. We have them in Lagos, in different zones in Lagos. I'm aware of the one that is located in Badagry, that is a zonal arrangement of the State Ministry of Women Affairs, which deals with gender-based violence. Any gender-based issue is being handled by that center, and is managed by the Lagos State government under the Ministry of Women Affairs. Then you also look at the way of applying verb act or verb law if it is committed in a particular state and it's related to that state. You could look at that. You also look at economic empowerment of the survivor. How does he live her life after the experience, after what has happened to her? But in this case, verb act is emphasized. How best can how do you apply that verb act? You know, whatever you do, you must do it within the ambit of law if you are going to help that your victim. So you could also look at mental health and psychosocial support. You know, in Abuja, if a young graduate or a university dropout at 21 years of age is facing, and such a boy or a young guy is facing depression, you know, there will be mental health stigma, suicidal ideation may be with him, and he may not even get require support to continue his life. In this case, he is getting limited support. So the best practice could be psychosocial assessment of such an individual, and you can also refer him to the appropriate rehabilitation center that could handle his case. There may be need for family counseling and community peer support, which we believe the social worker possess such skill to handle. So in this case, we will have helped that person to become a useful element in the society. You can also look at substance abuse and juvenile justice, perhaps in Kano. You know, most young Hausa boys these days, they are prone to substance abuse. Mostly the NDLEA parade most of these young guys on televisions, on radio, even in their press releases, as victims of drug taking and so on and so forth, especially tramadol and some other drugs. So how do you help Basil, a 17-year-old that is involved in drug use and theft? How? This particular person has issues of substance abuse, legal conflict, and family breakdown. All this will be facing him and will be affecting him. The best practice may be, the best practice could be, how do you engage the NDLEA, especially the NDLEA youth counseling unit, to handle his case through a number of programs in their agency? How do you assist such a person? One can assist such a person to enroll in rehabilitation and skill acquisition centers. This will enhance his skill and will enable him to become a reformed person and enable him to earn a living without depending on drugs. Then there is need for family therapy as well, and reintegration planning. How do you take him back to his family? How will the family accept him back into their society? How do they treat him after being rehabilitated? So that one calls for a kind of a professional touching. So this will give the social worker a kind of a background or a kind of pedestal to assist this particular victim. Thinking about family therapy, because the essence of everything is to allow that particular individual to become a useful member of the society, and that calls for family reintegration back into the family and as well in the society at large. You can also look at community development work, perhaps in Bayelsa or in any place. You're looking at a riverine community lacking potable water and edge access. Most of these riverine areas, even though they are riverine, they lack potable water for their survival. And then, oftentimes, a number of infrastructure is not even provided in their environment. Even though we are taking the large chunk of revenue of Nigerian government is from that area, yet they lack so many things. Even those that don't even produce anything, they have access to some of these facilities more than they do. So they face health inequality as an issue, environmental barriers, environmental degradation, pollution, water pollution, environmental pollution. They can't farm. Their farmland have been devastated. Their farmland have been destroyed. Then there is poor infrastructure as well. The infrastructure in those communities are not all that good. The infrastructure are not enough, are not adequate to address most of their problems and even their needs. Best practices. There is the need for community needs assessment. Community needs assessment in the sense that one has to go to that community and do a thorough assessment. It could be through participatory rural appraisal. It could be participatory rural appraisal approach that one will assess what are the problems of that community, what are their needs, and you need to differentiate, you need to distinguish between their first needs and assumed needs. A kind of priority list must come out of that assessment, and that will give a guide to anybody that is trying to intervene in their problem or to even ameliorate their suffering. Then there's need for stakeholder mapping as well. You identify those that are gatekeepers in that particular community. Different stakeholders that could be of assistance, because if you are looking at it from the angle of the government may not, and from experience, government at all levels cannot provide for the needs of every society or every community, cannot provide for the needs of every community. So there is need for collaboration, there is need for support from others, stakeholders, philanthropists, private sectors, and all others involvement is important so that a holistic development can be recorded in such community. So in which case, government cannot do it alone. There are aspects, there are areas that community also need to contribute. That brings about the idea of community development, because community must also contribute, and their participation is very, very genuine. If you don't involve them, that particular program may fail. So that is why we talk about community needs assessment. During that assessment, we will assist anybody that is bringing that service provider, or as a social worker that is bringing a particular intervention, we will assist him or her to succeed in that venture. Then there is need for mobilization of self-help projects, encouraging the community to also engage on projects by themselves. In this case, their active participation is guaranteed, because when you encourage them to embark on self-help projects, because that will have little or no support from government, because they will see it as their own projects. Sustainability plan will be built into such, because they are involved and they have even invested their resources in ensuring that they have that particular infrastructure or projects or program. If that happens, that particular project will be sustainable, because the idea of winners will be built into that. It becomes their own. But if it is done for them, as has always been the practice in recent past, that is top-down approach, bottom-up approach has not been so much embraced. Mostly government will just decide for some people, this is what you think they need, and you give it to them. And that is why we have abandonment of so many projects in the country as of today. Even when you design a program that you're going to give them money, you need to know what they actually need. Those people you are giving money, you are giving trader money to, those people you are giving conditional that are enjoying conditional cash transfer, how do you know that that is their first need as at that point? Even you are giving empowerment material, did you do any needs assessment of the beneficiary before that is being given to them? Then there's need for partnership. If there must be a partnership with NGOs and local health departments and other agencies, other related agencies. There's need for partnership, because you cannot do it alone. You look at others. You may even establish a partnership with traditional institutions. In this case, you are gaining insight into what their traditional belief is, and you are also getting support from traditional institutions. Traditional rulers will be much more interested when they are involved, and they know that you are doing that for their community. But if you don't involve them, if you don't collaborate with them, that may bring a failure to that particular initiative. Then we also talk about medical social work, talking about HIV positive widow facing stigma and isolation. And that could be, the issue may be stigma, economic hardship, lack of psychosocial support, and so on and so forth. From these identified issues, you can address them. You can take care of those ones through counseling and enrollment in any ARV program actually happening in different hospitals. Economic empowerment through cooperative. You can encourage such a person to be part of cooperative, or they can come together to form cooperative groups, and with that, their empowerment will be ensured. That is economic empowerment, and there will be no dependence on some other people again. What we have is going to be, they become a kind of providing for themselves without depending on anybody or looking for somebody else for support. Then there is need for group therapy and liaising with hospital welfare units. You link them with the right place or right places for them to get more support to enhance their well-being. The essence is to ensure that the well-being of every individual, without leaving anyone behind, is taken care of. That is the essence of why the social work programs or social welfare programs are being provided. However, while doing all this, there's need for some ethical consideration and reflection as well. You do not forget the ethical principles that actually hold the social work profession. Those principles must not be handled carelessly. Those principles must be observed, and such principle as confidentiality. And of course, you know what confidentiality means. If you are not allowed, you are not given permission to reveal some information about your client, professionally, you can't do that. You don't have that consent from your client. You have to keep the information confidential. And in confidentiality, there are a number of things that are actually related, that are connected, which we have to observe as professionals. Then, informed consent, like I mentioned, is important. For anything we do, the consent of our service user is very, very germane. You need to get the consent appropriately, and it must be written. That is why it is informed consent. It must be written and signed. You know, many people, they care less about this. They assume and they overlook this aspect. In all they do, as social worker, one must be conscious of that. You know, any intervention or anything, any activities, any program you are doing, you need to get informed consent of your participant or of your benefit, or who is beneficiary of your client or service user. In this case, you should also recognize cultural, you should also have a kind of understanding about the culture of the people. And we say such a person must be culturally competent. A social worker must be culturally competent. In this case, you must respect the culture of everybody. You must respect the culture of your clients. You must respect the culture of anyone you are getting in contact with, or you are relating with at whatever level. You must respect that person. When you give regard to the culture of that person, definitely your program or your whatever you have designed will be successful. And this principle of non-discrimination must also be observed. Don't discriminate at any level using any yardstick. You should not discriminate in matter of age, matter of sex or gender, in matter of ethnicity, education, resources, color, race, religion, social status, and so on and so forth. One should not discriminate. So non-discrimination as a principle must be well observed and well taken care of by social workers while doing this. You should also adhere to the Institute Code of Conduct. You know, as an institute, the Chartered Institute of Social Work Practitioners of Nigeria, we have an act that is guiding our behaviors and our attitude and our conduct as professionals. The code of conduct in that act must be respected, and one must adhere to that code of conduct. Any violation of any part of that law or of that act will not be treated with love.
Hello.
Any misconduct, any misconduct by a professional social worker will not just be overlooked. It's going to be treated as dictated by the law. In this case,
Hello. Hello.
act of
Hello.
hello, sorry, I just had interference. Sorry, can you hear me now?
I can hear you.
Now, okay, thank you. Then, what was the social?
I'm not hearing you again, no.
Sorry, just a minute. So in all these cases we have identified, I think along the line I mentioned the role of social worker. What's the role of social worker in this case? And how can interagency collaboration be improved? How can we improve it so that overall our service users, in this case our clients will have the opportunity of getting better services from us. And at the end of the day, at the end of everything, we'll have good story to tell. Thank you so much. So can I have your own comments, your contribution as well in all we have just explained.
Okay, thank you very much. First, in carrying out, you talked about needs assessment, you talked about participatory rural appraisal. Before you do all that, you carry out individual is either inspection, like you go to the area, you scout without anybody knowing what your intentions are. First, you know why you do that? So it will give you an idea of who you're going to approach in your participatory rural appraisal. Then after your participatory rural appraisal, like what you said, you do your needs assessment of each stakeholder. Then you talked about different subsets of clients. You talked about Kanu, about male drug users. I want to burst your bubble on that. Today in Nigeria, it's not just the male, the women too are seriously involved in drug use. And part of the program I run is on rehabilitation of female drug users. Women that are using drugs that are being rehabilitated. So what I do in the process when they've been, like in Kano State, I have a project in Kano State that I work with, they call them ISBA. ISBA is like a religious group in Kano State. It's a state government-owned organization. When this, you know, because of their culture of silence, their norms, the religious beliefs, the women are not supposed to speak. But in the process of being kept at home and different places are not being, they are to be seen and not heard, they involve themselves in different things. This act that the men are involved in, the women also involved. And it will shock you also that it's not just in today's Nigeria, it's not just in Kano, but it's across board. Because I at least as a worker, as a woman that's in charge of empowerment, I've gone to all the states in the federation. So you discover that the rate of women, you can find out from NDLEA, because we work with NDLEA, in the use of drug has greatly skyrocketed across board, whether at the local level, at the rural level, at the urban level. They've increased because of social vices. You see small children in school belonging to cults, both boys and girls, west, north, south, east. It's happening across board. So we have a crisis in our hands. So like I was talking about my project in Kano, so we work with the ISBA. It's like a correctional institution. They bring those girls, they do psychosocial support for them. They do mental reform. They carry out different reforms on the girls and health too. So after they've seen the girls are, responding positively, for those ones that are responding positively, for us to reintegrate them back into the society so that they will have skills that they will use to support themselves instead of going to prostitute or going to pilfer. We now give them those skills in maybe tailoring, in catering, in shoe and bag making, in different skills, in different subsets. We do that. So after we've trained them, we now give them starter packs to start business. After assessment, we carry out an assessment before we commence this training. Needs assessment before we commence the training. Then we do that, then we follow up. And we work with NDLE. We work with other relevant civil society organization and government organization in Kano State, including the Ministry of Women Affairs. Are you getting me? Hello, sir. Hello, sir. Hello.
Hello, but I just want to correct an impression.
Yes.
What the one I gave you, I said entirely they are just case studies. That does not mean it happens in those states alone.
No, I'm just saying that we have crisis in our hands, sir. I understand what you're saying, sir, but I'm just furthermore.
We just as social, just give me 1 minute, please. As social workers, we should look at the way we already know that we have crisis on our hand. That is why we are social workers, and when we have social problems like this, we now look at way of solving such problems and ensure that our tomorrow is better than today. You can go ahead.
So I'm just giving an example of what we do in Kano. So with those girls, and sir, some of those girls are married, they have children, they have husbands, but because of these habits they pick up, they end up being divorced and at times separated from their children. We do all those reintegration. For some of them, their husbands take them back. We have success stories. Some of them, their husbands do not take them, but now they are empowered on their own to take care of
they can stay on their own now. Better.
Yes. And they are being also monitored by the ISBA and Women Affairs and the NDLEA in Kano State. So thank you, sir.
Oh, great. That I love to hear, because I wanted to ask, have you been able to evaluate that particular project and identify if there is any missing gap or if there is any gap that needs to be filled or bridged so that such will not come up whenever you try to implement a similar project in some other state? And but you ended up with that success story, which I cherish so much, because what we need now is to ensure that whatever intervention we are giving out, we must be able to measure the outcomes and impact. In fact, the impact is much more important, because if there are no impact positive in this regard, definitely all we have done amounts to zero.
Yeah.
So we are, as social workers, we should be wary of that, to ensure that if we are going to embark on any project, we are going to undertake any project, we should look at it very well, we should assess very well. And coming to needs assessment, my sister, in needs assessment, because it's a community that is involved, there's no way you can just go to a community without getting their consent, except you are very familiar with that community. You need to see some people. You cannot just go to any community without getting to know some stakeholders that are gatekeepers in those communities. And that will even enhance your whatever you want to do. And for you to even start any participatory rural appraisal, you don't just go there and say, we want to start participatory rural appraisal today, and you start. No, 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 no. You must have done some underground work. There must have been a number of planning
Engagements.
underground engagement. Thank you. There must have been an engagement even before while the project is being conceived. While the program is even being conceived, they must be involved at every stage of that particular project. Otherwise, one will run into what I can call barbed wire, and we not want that. Apart from the project failure, even that individuals that are even involved in such projects may even have problems as an individual. You know, we are human beings as well. We cannot just go to a high risk community. For instance, perhaps like Goronyo in Sokoto, or you go to Katsina, you go to those crisis areas. You know, one must also be conscious of his or her own security. Thank you so much for that insight, and it's so practical that you have given us the experience of that intervention you have in Kano, most especially in part. You know, why emphasis has always been on those big cities, because honestly, most of these things that happen, the larger percentage is in the cities. The larger percentage in the city, because many people, most of these youth, they have migrated from the rural setting to urban center in search of a greener pasture, in search of some other things best known to them. Hardly will you see a Yahoo boy in a rural setting. Hardly will you see those in the rural setting may not know, but the percentage of those that know will be very, very minimal. But all the same, we are all human beings, and we live in the same country, and we live in the same art, and we are in the same world, and we need to live well. Thank you so much. Our well-being is very, very important. Do we have other contribution? I've seen others have joined us. I can see Imen and Susanna. Do you have contribution as well in this discourse?
No, sir.
Okay. Except you tell us why you came late. Okay. Hello. So, any other comments? Essentially, we are to look at many cases, and if we are going to look at all cases, we may not even complete this on time. Since we are experienced people, we have handled some of these cases. All we need to do is to ensure we add the best practice to it, so that there can be an improvement, and that's the essence of continuous education. And we have had. There's no way this will not improve your skill on your desk. But as I always tell my people, as I always tell any colleague, what I tell them is, let us take Nigeria as our own project, as our own personal project. We should look beyond today and look at tomorrow, and design or decide decide a way to ensure that Nigeria becomes a better place for our children and for our children yet unborn. So that should be our desire. That should be in our mindset, so that let Nigeria begin to be better from our table. Let it begin from our home. If I can vouch or I can decide to ensure that all things or everything will be well from my end, and you also decide from your end, and everybody should do that, you know, the country will be better. Like I said when we started, if tomorrow you are a director today, tomorrow you become the permanent secretary, and next tomorrow you become minister, or next tomorrow you become governor, or next tomorrow you become this and you become that, you become commissioner for women affairs, commissioner for education, commissioner for all this and that, or commissioner for poverty alleviation, or minister for this and that. Are you sure you can do things differently as a social worker now? Because our main focus is to ensure long-term well-being of every individual, long-term well-being of a group of people, long-term well-being of the society, of the community at large. We want to see long-term well-being of Nigeria. What are those things you are going to do differently that will bring that particular change? You should think about it. Even as a social worker now, what are those things you think? What are those things you think you need to bring in as at now that will bring improvement in the system where you serve? You should look at it, not minding what happens around you. You know this. You know, people say, or how do they put it? When you do it is only what you do that is good, that is actually sustainable. If you do things that are in the contrary, those are not sustainable. It has a limit, it has a time. It has a time. And that is why I always say good sense. Good sense is always good. I don't believe in common sense. I believe in good sense. How? Common sense in the system, in any public service today, is to follow the rules. Follow the rules, how do I mean? Is to do things as they usually do it. They do business as usual. Do you have to follow that and be doing business as usual? Most people that have been doing business as usual, is that not common? It's common. And is it good? No, common sense is not always a good path to tread. I believe in good sense. Let us apply good sense in whatever we do. Many people in government are corrupt. Many people in private sector, in public service are corrupt. Many people in private sector too are corrupt. Even people on the street, even the traders, the artisans, the mechanics on the roads, the manufacturer, everybody, industrialists, almost everybody is corrupt. It's not peculiar to a particular sector, but how this is common. When you go to a hospital, if you can tip them, they will quickly call you in for doctors to attend to you. If you don't tip, you are going to wait on the queue for long. You go to the bank, you have to queue. If you know somebody in that place, you can just bypass the queue and you get to the first position. So are we saying we cannot change this for better? Since we are looking for better Nigeria. So my sisters, I think you are all sisters in this house, on this call. We need to look at that and try to look at way of improving our society. I want to thank you most sincerely for this particular interaction. And I wouldn't know if there are questions that you may want to ask me. so that we'll call it a day. Hello? Any question, any comments? Do I take this as no comment or no question or no contribution? Hello, can you hear me? Hello, somebody should answer me now. Oh, are you people here? Hello?
Hello, sir.
Ah, okay. I wanted to confirm whether you are with me or not. It's all right.
I'm with you. I'm with you.
Okay, you heard me. Did you hear me very well?
Yes, sir.
All right. Thank you so much. So until we have the opportunity of meeting again, if there are questions, if there are comments, if there are issues you want to raise with me, you are free to do that. So thank you and enjoy your weekend. Bye bye.